It is very often symptom, tinnitus, but to manage it, it is necessary to know the types of tinnitus and what are the possible treatment for them. In the international classification of disease, we have tinnitus, we have auditory recruitment, and we have hyperacusis. Clausen and Schulman has proposed the 4 types of tinnitus, and we will discuss one by one. First type, Bruit. This is the tinnitus which can be documented by the special devices, and the most dangerous is aneurysm. It's the defect of the blood vessel wall, and it is life danger if this exists. Mitral insufficiency, bad symptom but not so dangerous as the previous one. Brain vessel stenosis, less dangerous but also not so good for the patient. Temporomandibular joint sounds, some small movements of temporomandibular joint with, for example, tremor or something like this, might provoke the tinnitus, and this tinnitus might be documented by special microphones. Non-pulsating or periodical tinnitus might be caused by the atherosclerosis, and this is SPECT documentation of this. Then autosclerosis. This is one of my patients, and it means the calcification of the ligaments, and derivatives of the etidwanic acid appear to be rather interesting for the management. In some cases, autoacoustic emission might cause tinnitus sensation, but autoacoustic emission might be easily recorded and documented. Then, second type, endogenic mascable. It is related to neurosensory problems, and this patient had tinnitus in his right ear, high frequency tinnitus. And in many cases, they propose masking devices, masking noises to treat. Let us use posturography and see whether each patient needs the external noise. Posturography is done without any hearing test. So what we have done, we have made posturography. You see the 3 columns above row and then 3 columns down row. Between them there was so-called phonation. We have proposed to listen music which was running from one ear to another one. And we see in this patient the improvement, serious improvement of vestibular function after phonation. The same we have done with the other patient, and phonation has caused crucial decrease of vestibular and visual function. So, for this type of tinnitus, nootropic groups are very effective, and we exclude smart drugs because they are not so good for the patient. Third type, exogenic non-mascable, usually caused by external sound. Here you can see the patient eyes and some small movements of the eye. The same patient with phonation. You see the earrings. You see that his eyes are more moving than in the control examination. And now we have a patient with severe hyperacusis and non-mascable. Look how exaggerated are the eye movements. In this case, vestibular blockers are indicated. Then, fourth type, slow brainstem degeneration. It might be age, severe head trauma, severe stress, or intoxication. Let us return to the patient we have spoken about already. The case when we are speaking that noise, external noise, is not indicated for the treatment. The therapy is difficult. We have to activate protein synthesis in these patients. We have to propose sulfhydryl group donators, nootrops, vitamins, and microelements. So, it seems to me that I have shown that it is important to differentiate different types of tinnitus in order to better cure, in order to better manage. And if you want to know more information, you are welcome to attend International Business Academy in Kiev. You will stay at this motel. You will have the meal in the restaurant here, and the best time to attend is late spring